Observe. Good morning, my dear colleagues. Thank you very much for the opportunity to talk on a topic that is so dear to my heart. Can I have the outline, please? Thank you very much. It's just to talk about the cataract surgical rate. I'm going to follow the outline that you've seen there. And let me just say a little bit about cataract and cataract surgical rate. Cataract is the commonest cause of blindness worldwide, and it's the same here in our environment. And it is one of the surgical procedures that we were taught by the time you start to learn surgery in ophthalmology. And it beholds us that we should know what is going on about this parameter. What are we doing? What are the others? What have they done to succeed in generating a lot of cataract surgical rates? So we're going to kind of work together, think together, and at the end of the day, be able to find solutions by the time the three of us finish our presentations. Next slide. That's the definition of cataract surgical rate. That's the total number of cataract surgeries performed per year per million population in a setting. Can I have this next slide? So, next slide, please. Take the map of Africa. So if you look at this, okay, I just got it. Please, let's have it, yes. And we make it bolder a little bit so that we can see where Nigeria falls into, and then the other parts of Africa. So if you look at here, this is where Nigeria is, 250 to 400. Can you see that? And then you can see the Gambia. The Gambia is here. So we can see that the Gambia is far up there than where we are. I just want to do that comparison. Can I have the next slide? So, what do we have? Let me start with India, who has done so much in generating cataract surgical rates. They have a total number of 30 states. We have 36 states in Nigeria with the Federal Capital Territory. The total population in India is over 1 billion. The cataract surgical report from each of the states collated together gave that this data is 2013, over 6 million. And the cataract surgical rate then, 4 years ago, is over 5,000. So you can imagine what they have now, because they are coordinated and they're working every time on getting appropriate data. Let's have the Gambia. The Gambia, we have a total population of not more than 1.5 million. I can't give you the exact data now, but the cataract surgical rate is over 2,000. Now we come back home. Let me give you a little bit of what I know. I know as of now, we don't know what our cataract surgical rate is because of paucity of data. Everybody is in their own corner, collecting data, not disseminating to where it should go. We don't know where it should go, actually. If you ask many people here, it is just recently that we are asked to send it to the Secretariat of the OSN. Before, I don't know where it goes. So you can answer the question, where? I can't hear you. But then, I can say roughly, you have 300 to 500. And then from the little, I can say other figures that I got about 2 or 3 days ago, cataract surgical reports. For the teaching hospital, and I work in one of them, we have problems. And we must sit down to solve the problems. The least I had was 50 over 6 months. So projects 100 a year. The maximum is about 200. Projects 400 a year. Where are we? That is cataract surgical report, not rate, because we are collecting from each center. For the private hospitals, they are doing more than the teaching institutions and the public institutions. So you can have from 100 to 300, and then if you add their outreaches to it, you can have between 500 to 1,005, and that's maximum of 3,000 in a year. That is for the private. Can I have the next slide? Thank you. So, We know that cataract surgery is the most frequently performed surgical procedure all over the world. It provides significant long-term and cost-effective improvements in the quality of life for patients of all groups. Thus, it must be done properly and also readily available and also affordable. Next slide. The Gambia National Health Program is recognized globally as a role model because of the design and strategies used to establish the eye care services. This has reduced blindness prevalence for them in the Gambia from 0.7 to 0.4%. It's a level comparable to European countries despite growing increase in the population. Next slide. The goal of the National Eye Health Care Program in the Gambia then is to improve the quality of life of the Gambian population by reducing the burden of blindness and to achieve a comprehensive and high-quality eye care services, which is accessible and affordable to all Gambians in line with the goal of Vision 2020. How did India and the Gambia achieve the level of CSR? How are they sustaining the CSR? The Gambia, they draw a plan and they train who they call cataract surgeons. And I can remember, I think these are like O-level students who was taken through maybe a year or 8 months of training, and they become experts in cataract surgery. And they do only cataract surgery, no other operation. In the Gambia, they listen. In Nigeria, what do we do? Give us 1 foot and we take 10 miles. And that is what our problem is. So we may not go through that route. We have alternative. Secondly, they actually had some visiting consultants. I know about 10 from Nigeria went to the Gambia. Also some from the Ghana to help them to actually kind of clear their cataract backlog. But some of them, in the process of doing that, they got trained and they came back to Nigeria and they are useful to us. So we must look for those people who went there and were trained and they can be useful here. Then they had a program of continuous training of local professionals. Local people, they use local people to achieve their aim, even though they still invited people from other countries to assist them. But now they are self-sustaining and they are using their own people to achieve this high cataract surgical rate. Next one, India. India has so many plans on ground to continue to achieve their cataract surgical rate. I'll mention some of them. Establishment of vision centers in India to reach the rural areas. Manufacturing of low-cost consumables in India. We go to India, we go there to train. We go there, we use their consumables. So they have actually drawn some plans. Many training institutions in India to improve skills. Next one. What is the way forward for us here in Nigeria? 1, we must be committed. We must be passionate, especially those of us who are eye caregivers. We must work together in collaboration as a team. All eye care workers must work together. They have used that in India, they have used that in the Gambia. Continuous training and professional development of eye care team. Strong government support, which must be necessary, especially a budget line for National Eye Care Program by the Ministry of Health. Next one. Coordinated and organized data collection. I mentioned before that recently is when we were told to send our report of cataract surgical to the OSN Secretariat. We must be able to know where to send the data. And then some of our colleagues feel it is my work. Why do I need to disseminate it? It's because we need to improve on what we are doing so that people can see how they can help us. So your data should be sent to the center that is asked to be sent to. Training of coordinated and organized data collection, I just spoke about that. Incorporation of primary health care into primary health care. We all know that majority of our cataract, what I can call overripe cataracts, are in the rural areas. They are there, they are sitting down. And if you don't go and fish them out, there's no way you can find them to come to the teaching hospitals where we are always sitting down for them to come and meet us. So, how do we do that? If we can incorporate and make it work, primary health care into primary health care, we'll be able to fish out all these cases at least bring them to that primary health center, and from there cancel them and then do either on-site or transfer them to anywhere we want the operation to be done. But the quality surgery also actually encourages people. Let me give you a scenario. Last week, a young man who works at the Zenith Bank is like the regional manager, has his mother with him in Lagos, and he came to me. I'd like her to come and see the ophthalmologist because I felt she has cataract. I said, well, how did you know? She said, okay, they told her before. So I said, go and bring her. So I was expecting them to come on a Thursday morning. Only the man and the son came. So I now said, what happened? She said, no. My mother said, no, too far. I won't come. My cousin did his own. He got blind. My brother did his own. He got blind. No, I don't want to be blind. Let me just carry my eyes. So it's bad advertising because the surgeries were not properly done. So good surgeries actually help to improve our advert. Training of pecs and chews to work in primary health centers for identification of cataract. Next slide. Tertiary institutions working in close collaboration with the outreach centers and primary health centers, also to harvest the cataract. An appointment of regional nodal officers to collect data on differences. Next slide. Conclusion. I concluded, and I'm saying to everybody, where there is a will, there is a way. We have the will. We've been trained as ophthalmologists, and the majority of us can carry out surgery. There is a will because all of us are passionate. All of us are already committed. And so let us walk in the way. So help us God. Thank you, everybody. God bless you.
Thank you, Professor Akinsola, for a good presentation. We'll move straight to listen to Professor Adeboju. She will be taking us on proposed next steps in CSR data generation in Nigeria.
Let me show them how to use it. The stuff on it is here. Let me show them how to use it.
Good morning, Madam Chair. Please permit me to stand.